2 days. It ends on Sunday. That is a story we'll also be focusing on for you. But then let's focus on a story that we had yesterday, and every single person focused on Uhuru Park when Doctors Union officials were released, and the whole country focused on that entire story. But now let's tell you the story behind that story. For 2 months and 14 days, doctors in Kenya have controlled the headlines. Many have heard the voices of Doctors Union officials and those involved in mediation talks. But tonight, KTN News takes you exclusively behind the headlines with the untold story of how Kenya as a nation has survived and borne the pain of 74 days without the 5,000 doctors. It is a story of harsh realities, adjustments and shock that ironically also reveals the significance of some of the reforms the doctors are demanding. Here is Timothy Otieno with that special report for you.
23-year-old Lois Sau begins a journey she has embarked on a daily basis for the last 6 weeks. But even though she knows the end result may just be the same, every morning she leaves her home seeking medical treatment at the Voi County Hospital about 5 kilometers away. On this day, the story is no different. The renal unit at the hospital is completely deserted. Doctors have abandoned the hospital, and with them, the weekly supplies meant to have the dialysis patients get the much-needed treatment they seek have since been depleted. She heads back home distraught. Tomorrow, things may be different. Lois was diagnosed with a kidney complication late last year, just mere weeks before the start of the doctor's strike, and since then requires dialysis twice every week. She recalls how prayer has been the only thing giving her strength at such dire times.
Mchungaji wako tusima kaniombea, kanaambia Lois hautakufa, ukana imani haukufi, lakini basta. Nilipoombea nikupita mwingine akapigwa simu akaja kaniombea, ile roho ikawa imetulia, nilikuwa nafuta roho ikawa imetulia.
Her story is one that Amon Juma from Nakuru County may relate to. Perhaps maybe even worse for Amon is that the ongoing strike has cost him his marriage. His wife developed complications in her pregnancy days after the strike began. He rushed her to the nearest hospital but didn't get treatment.
Alikuwa na ile ambayo tunaita ectopic pregnancy. Mimba ambayo inapatikana katika the fallopian tube instead of the uterus. Akawa wanamharakisha sana aende afanyiwe operation ndipo aweze kuondolewa kwa sababu it is an emergency.
Despite taking her to a nursing home, the wife passed away, becoming the latest victim of a protracted industrial strike biting the nation. The evidence of the strike is perhaps manifest across most public health institutions. The Pumwani Maternity Hospital is one such institution. Here, the wards are as silent as a graveyard. When we arrived here, we found the nurse in charge all alone, save for this lady Agnes Karambu, who gave birth here just yesterday. The first patient to come here since Monday this week.
Now this is a free maternity hospital with one patient. A whole big maternity hospital with one patient. Surely, it is unheard of. It has never been like this before.
We are seeing the worst of what could have happened in this hospital, where the public know that there's no doctor, and so they don't turn up. So when they don't turn up, I don't know where they are going to.
For a hospital which, when operating at an optimum level, delivers between 80 to 100 babies a day, the current average of about 5 babies a week could be more disturbing for Gertrude Nabwire, who has been a nurse here for more than 15 years.
A nurse is there to nurse patients. So this is a scenario where you are nursing beds, empty beds. Surely that is not nursing. There's nowhere written that you are going on duty, you are going to nurse beds. And it's a situation whereby we are nursing 66 empty beds.
The long and protracted medical doctor strike has affected basically 3 levels of health institutions in the country. There are the public health institutions with whom doctors have withdrawn services for well over 2 months now. Private health institutions, some of whom have been accused of reaping bountifully financially from a crippling public healthcare system. And then there are the faith-based organizations that have borne the greatest brunt of this long-drawn strike. And the evidence of that burden in this hospital is crystal clear. Early last month, the Ministry of Health reached an agreement with all faith-based hospitals in the country to mitigate in the ongoing crisis by providing critical medical support for patients who need it. But now, weeks into that agreement, the few doctors serving such institutions have been stretched to their limits, serving nearly 1,000 patients daily. Dr. Kimani Ngaruya, for instance, is the only pediatrician at the St. Mary's Hospital in Langata, handling approximately 94 babies in a ward meant for just 40 of them.
There is much that one person can do over a period of 24 hours. So we've had our doctors having to do shifts both day and night. Majority have also not had the opportunity to take leaves, which of course brings issues of burnout.
One of the demands by the doctors in their CBA is the hiring of 1,200 new doctors annually to reduce the backlog of patients witnessed at public hospitals. It is for that reason that Dr. Kimani says he supports his colleagues who recently spent 2 nights in jail for dishonoring a court order to end the strike. Private hospitals have been accused of making a killing with influx of patients to their facilities, but the numbers, according to the Nairobi East Hospital's administrators, remain low. The facility only has 23 patients in the general ward, with 7 at the intensive care unit and only 3 at the maternity wing. The pricey nature of private facilities has kept many at bay.
Ningekuwa nimetibiwa mapema na expenses yenye niliokaa siku hiyo singeokaa. Hata sasa niko na bili kubwa. Hiyo inamaanisha lazima nifanye mjango.
These ones who come, we always pray that we don't complicate after delivery.
Where normal deliveries of babies is free at public hospitals, here at the Nairobi East Hospital, you have to part with between 25,000 to 35,000 to deliver.
We have so many unpaid bills. We need to have our supplies, we need to pay our consultants. But now when you have a patient who has accrued a bill of 2 million, and these bills are as a result of the drugs, the medication given. So you need to restock the stores. How do you go about it?
And with the doctor's stalemate still ripe, Kenyans are turning to the most unlikely of sources for help. 80-year-old Veronica Saniengo is a traditional herbalist making big money from desperate Kenyans seeking her services in Iten, Uasin Gishu County. She receives about 20 sick patients a day who receive herbs for their diseases. Never mind the fact that here, the prognosis is simply done by the touch of a hand.
Na ulifunzwa na nani?
Sasa mimi kine tane. Sasa na Mungu. Na kwa naleta akili yangu najua.
Kwa sababu hatuwezi jua ni shida gani kwa mwili, tunakunywa hii dawa tu lakini inatusaidia.
Wakikosa dawa huko, wakikosa madaktari wanasema waje tuende ya kienyeji kwa sababu hasa mtu akirudi nyumbani bure ni mbaya na ugonjwa inazidi kwa mwili. Mpaka wengine wanakuja kwa shosho, wengine wanaenda kwa chemistry kununua dawa.
For the many like Lois who may not even afford the little charge offered by herbalists, the sooner the doctor's strike ends, the better for her.
Magonjwa narudi tu kwa sababu nguvu zinaisha, kula na shito na kula sahi. Nakaa sometimes nakuna maji peke yake, nashinda na maji vitu peke yake. Najaribu tu kidogo naona kama tumbo yangu kama kuna kitu kinaguruma kwa tumbo.
The number of lives lost over the last 74 days has been estimated to run to the thousands, even as many Kenyans look to those placed to guarantee them accessible, cheap and effective healthcare to resolve the crisis before a nation